so many people have died from drug poisonings that there's not very many people left.
The Alberta government has released its latest report on opioid-related deaths in the province. The findings showing opioid-related deaths and opioid-related EMS calls are down over 50% year over year for the month of June. But despite a positive trend, there still remains skepticism among some.
Well, they obviously have never been anywhere near a red line train station. There are a lot of people overdosing. I've seen it a lot, especially near like areas of the city that are a little bit more like rough.
From what I've seen, it's getting worse, but that's just what I see.
The government of Alberta reporting there were 78 opioid-related deaths this June, 53% lower than the death toll reported last June. Opioid-related EMS calls also down across the province, from 1,155 EMS responses in June last year to only 478 EMS responses in June of 2024. Dan Williams, Minister of Mental Health and Addiction, says in part, we remain cautiously optimistic with an ongoing downward trend in the number of people losing their lives from addiction. Our government knows that for anyone suffering from addiction, recovery is possible. That is why we are focused on the Alberta recovery model, creating a continuum of care with the right services to bring people out of addiction and into recovery. Alberta has led the way for several other jurisdictions looking to do the same. But not everyone is a fan of the government's recovery model.
I anticipate that the current government will claim that their policies have resulted in this decrease. I would strongly dispute that point. There is a decrease happening across North America.
Dr. Jackson says there could be a variety of factors to why the province is seeing a downward trend in opioid deaths, saying drugs may be less toxic than before. She also says the government shouldn't be shutting down supervised consumption sites. They should be improving them.
What we need to have for a supervised consumption site is a chair and a healthcare professional. So this is not something that's going to take a lot of infrastructure. It could be something replicated in doctors' offices, patios outside for people who are inhaling drugs. It could be at a pharmacy.
The city of Calgary this week voted in favor of the province shutting down the city's only supervised consumption site. In Calgary, Margot Rubin, City News.